Okay, that was very inspiring. Thank you. I would welcome anybody coming to the microphones now that either wants to reinforce these points, or all you researchers out there here that want to unturn any rocks. Katie Schmitz.
Yeah, so I am standing here not as a researcher, although I am Dr. Catherine Schmitz. I am also the primary caregiver for a partner who has an advanced stage nasocyanal cancer, which is a cousin of head and neck cancer. And she's going to ring the bell in chemo on Wednesday and ring the bell in radiation on Friday. So we're looking forward to that, believe me. So I've learned some things in this process of being a caregiver that I think are important to share. And I'm curious to have Mr. Harrison reflect on this, and to the extent that she can, our other speaker as well. One is that I've learned that there are spaces in between the point of biopsy or maybe a cancer and surgery, as well as from surgery to whatever adjuvant treatment is going to happen during neoadjuvant treatment, that we may not be using as effectively as we could as a practice community. I think that there are opportunities for us to intervene on physical activity and weight control and nutrition that I think we haven't taken yet. Another thing that I would state is that I of course, being the researcher I am, I've gone out and tried to look at what is the evidence for Sarah's cancer, for what we do, and it doesn't exist. It doesn't exist at all. Now, she happens to have a very rare cancer, but we've done an awful lot for breast. We've done some for prostate, but with the possible exception of a few people in this room, including Carrie Cornier, very few other sites have been addressed with any great regularity. The other thing that I am present to that I think is an important point is that was raised by the first speaker is we consulted a naturopath. We were interested in supplements. We were trying to increase Sarah's chances of doing as well as she could throughout treatment, adjuvant treatments, and her medical oncologist shut it down completely because he didn't understand what was in these things. We need to do more research on what these things are. It's quite possible they might have been helpful to her, but certainly out of the fear of any kind of harm, we didn't let any of that go forward. So, and when you scratch the surface a little bit, you find out that we know way less about the benefits of specific nutritional interventions for side effects during treatment than we know about exercise. So, thank you. It's on now.
Is that good? Okay. I come from a consulting background, and the consultancy I learned from Arthur D. Little was to kind of do a mind dump and think outside the box. And I tend to look from the outside in. I think it's so much research looks from the inside out. The first thing that happens when a cancer patient comes to you, comes across your door, is a person has come across the door. If we start from the standpoint that we're dealing with a person that has a malady, rather than we have a malady that needs to be treated, it's a wholly different perspective. And it sets a stage for looking at all of the things that we can bring to bear on maintaining or creating the greatest wholeness of this person, as opposed to how we can treat this metastasis. And so all I can say to you is, I'm not a researcher, never will be one. All I can say to you, and I believe in research, I've benefited from research, I'm grateful for research, but it's all about the whole person, or why do we need to research? So let's begin looking at person-centeredness as we deal with these diseases and the research that we want to do, and then focus in on the specifics.
Any other comments? Lucille?
Hi, Mr. Harrison, Lucille Adams Campbell. We've known each other, but I would never have recognized you 40 years later, so it's good to see you again. My question is, we've done really well with women's health in general, particularly breast cancer, and my group in particular has done quite well with women's health. We started going into the realm of men's health, prostate cancer, and doing exercise interventions for minority men, particularly African American men, who always will start out strong the first week, but then dwindle. What could you, as a researcher, what can you advise to us? We use a community advisory board. We use many different ammunitions, I think, to keep the men engaged, to come to them at their point. You've been successful in your Skype approach. Is that something you would recommend to us to reach people?
I didn't hear the last one.
Your
Well,
Skype.
yeah, the Skype experience was a wonderful one because this person whom I've never met was able to communicate with me, show me things to do, get down on the floor, observe my reactions to what she was saying. Simple technology works wonderfully, didn't cost anything, didn't take an awful lot of time. It kind of made things, it really made things very easy for me to stay engaged with her. I could give her my status and she would email back to me some adjustments to my activities in just a couple of minutes. That kind of technology, is very beneficial, very easy to do. I'd like to see that expand to take in more disciplines so that not only do we have a patient and an exercise physiologist communicating about a condition, but that we have other service providers communicating with each other. Because one of the things I experience is a gap, is that my oncologist and my cardiologist and my PNC and the nutrition people don't communicate with each other about me.
I want to make a point, taking the chair's prerogative here. So much of what we've learned has been in breast cancer. And in that breast cancer model, we hold this, not that it won't work, but we hold this concept that, oh, you need to pull these women together in a support group. And what I find, and you can comment on this, the men that we have in our studies with prostate cancer, they don't want anything to do with necessarily with the support group. They are much more happy with an intervention that's delivered one-on-one. And it kind of goes back to this model. We need to really make this standard of care and put it into the medical, integrate it into the how we deliver medicine.
I have a real strong comment about that. My wife won't do a support group either. She doesn't like them. I, on the other hand, no problem. Here's the thing that's so important from my perspective, and that is that we are individuals. We are persons. If you can find out what matters to each of us to the extent possible and build a relationship, then you're going to have more effective communication. When my oncologist walks into the room, we have a person-to-person moment, fraction of a second. He acknowledges me, I acknowledge him, I'm happy to see him, he's happy to see me. When he leaves, it's the same way. In between that, we get down to business, and we do it in a very unique, special, personal way. To me, the key to the most effective medicine is to acknowledge that we're all different. And part of the effective communication comes from recognizing that you're dealing with a different person. each time, but you're dealing with a person. You're not dealing with a disease. You're not dealing with a malady. And so if you come at it from that perspective, then it sets the stage for more effective communication.
Okay, we have time for maybe one more question
Yeah, good morning.
or comment.
Yeah, I'm Bob Boone. I'm the president of the Medical Fitness Association. And for about 25 years, we've been practicing the space, Robert, you're talking about. Not trying to aggrandize what we do because we don't have no research. We've got a lot of anecdotal evidence in cancer wellness programming across the country and around 13 countries around the world where people do better with personalized programs that are based on their health status, their health risks, and their personal goals, and that are tied into a true personalized medicine, a partnership within the continuum of care to look individually at what a person's needs are. So looking at a more holistic approach. So my comment, I'm not a researcher, I'm a hospital administrator by background. And for the last 3 years, I've been here at the association. And I'm saying there's a group out there that's trying to do these kind of things that's willing to learn and is a tool for researchers as if you begin going down this road. There's a lot of people out there that would be able to help in terms of pulling together some of the data around cancer wellness, cancer exercise programs. I know we partner with the Exercise as Medicine program and the ACSM in trying to proliferate these kinds of programs across the country and across the globe. So my comment, Robert, is that I applaud what you're doing, and I think it really sets the stage for people to build in nutrition, lifestyle management, and exercise as key components of their continuum of care and of their cancer treatments. So thank you.
Thank you.
Are there any more? Because we actually have one.
Hi, good morning. Brenda Nevajohn with the Oncology Nursing Society. It's something that I want to share, and Mr. Harrison, I love that little, it's a mindset, not a program. The American Nurses Association, that represents the 3.6 million nurses in this country, has recognized that nurses of the health professionals are some of the unhealthiest health professionals. And so as we look at our relationship with patients, if we're not embracing that mindset that you talk about, we might have a program but not be evident of that program. And so they're undertaking a multiple year campaign, which the specialty organizations in nursing are also a part of, that's called Healthy Nurse, Healthy Nation, and really trying to accelerate the health of the nurses in this country so that they can be fostering the health of the nation. And I love that little mantra of yours, and I think the Oncology Nursing Society, if you're willing, will use that in our campaign with our members as well. Thank you.
Well, good. Well, I want to thank Robert.
Thank you.
I want to thank Karen. And I want to thank you all for your comments. And I think we're ready for our next session. So thank you.
Thank you.